Hello, I'm Dr. Bang Ji-sung, the hair wizard who protects your hair. It's a pleasure to be here. Anesthesia is a topic that many people worry about and feel anxious over. Honestly, it's not so much about the surgical method causing a drastic difference, but it tends to vary more depending on the surgical scope and the surgeon performing the procedure. However, comparing incisional and non-incisional methods, incisional involves line harvesting, requiring anesthesia only around that area. Non-incisional, though, harvests from a broader scope, so the anesthesia itself will naturally cover a wider range. So for non-incisional anesthesia, we need to cover a wider area using a small amount of anesthetic. And for the incisional method, we anesthetize a narrower, longer area. What you're probably more curious about, however, is whether it's conscious sedation or not. To put it simply, conscious sedation is when we help you fall asleep while we administer the local anesthetic, so you won't feel any pain during the procedure. Getting conscious sedation means you're briefly asleep. It doesn't mean the pain is gone. So you receive conscious sedation, then local anesthesia, and then the medical procedure begins. It can be used for both incisional and non-incisional methods, but non-incisional surgery takes longer, so administering conscious sedation for that long can be a bit of a burden. For the incisional method, many often dislike the sensation when tissue is removed from the back. That's why I believe many clinics use conscious sedation during follicle harvesting for the incisional method. And personally, I explain that if you're getting the incisional method, it's better to have conscious sedation during the harvesting. This is because many individuals recall that sensation quite negatively, and I advise them there's truly no necessity to endure an unpleasant experience. The non-incisional method isn't as awful as you might think. Therefore, because the non-incisional procedure is quite lengthy, even though conscious sedation is challenging, I suggest opting against it. That's my recommendation to you. Since an injection needle is involved, there's pain when the needle first pierces the skin. But actually, the greater pain comes when the anesthetic drug spreads inside the body and irritates the area. You'll feel pain twice, once when the injection needle first enters and then again as the drug spreads. Even from my own perspective as a doctor, I employ various methods. I try to create a more relaxed and comfortable atmosphere, help the patient unwind, perform some massages, use a vibrator. I employ various methods. But truthfully, even using the exact same approach, some patients experience almost no pain, while others feel a significant amount of discomfort. Therefore, because this truly varies individually, it is honestly difficult to provide a definitive answer. However, if the operating surgeon takes a bit more time and care, the pain can indeed be somewhat reduced. So if you're quite sensitive to anesthesia, it would definitely be beneficial to make that specific request. If it were me, I'd try to persuade the patient to proceed with local anesthesia and avoid conscious sedation. However, some clinics do allow you to choose, but you know that if you opt for conscious sedation, you have to fast, right? If you planned on conscious sedation, it's fine. But if you came for local anesthesia and then decide on conscious sedation, you will have to wait a while. Given that the typical fasting period is at least a couple of hours, the surgery might potentially be delayed. This is something I always make sure to communicate. Just bear with it briefly, it gets better. I advise against conscious sedation, making local anesthesia as painless as possible. So today we've gone over the different anesthesia methods. You're probably concerned about it, but it's best to ask about this and confirm everything during your consultation. I truly hope this information has been helpful to you. Thank you.